Well, I want to thank you all for being here on a beautiful October afternoon, unseasonably beautiful, and excited to talk to you today about the Crisis Intervention or Crisis Services Levy. A lot of times we get questions about, a lot of people are aware of this levy, that it's coming up on the ballot, but there's not a lot of information out there right now about what exactly this levy does or what it is. So I want to start really briefly with what is a crisis. This levy is really centered around individuals in our community who may be experiencing a crisis. And you can think about that as a teenage nephew who has a mental health crisis and is contemplating suicide. You can think about that as someone who broke their knee and got an opioid addiction after abusing painkillers in their recovery. You could maybe think about that as someone who lost their job and has lost or is losing their housing. Crisis affects every one of us. It affects people in my life, it affects people in the commissioner's life, it affects people in all of our lives. And one of the things that we have done as a community over and over and over again is we have made a collective commitment to one another that we take care of ourselves. We take care of our community. We take care of people in our community who are experiencing crisis. So that's the root of what this levy is about. It is about how we choose to take care of one another and how we choose to make our community a wonderful, vibrant place to live, work, and play. The pandemic came with a series of challenges for our community, for communities around the Mountain West, and for communities throughout the country. How we've chosen to respond to that in Missoula, Montana is really unique. We've spun up a number of programs that really are rooted in the notion of responding to people who are experiencing crisis. And we've done that very quickly, and we've done that using federal American Rescue Plan Act funds. Unfortunately, those funds are running out, and we have a choice as a community. We can continue to make that collective commitment to one another and to supporting people within our community, and we can figure out a way to sustain these funds, or we can let the programs expire. So that's really the choice before the voters this year, is whether or not we continue to fund these services that have had meaningful impacts on the outcomes of lives of members of our community, or whether we don't. So with that, I'll turn it over to Commissioner Slotnick.
Thanks a lot.
We have a number of folks who will describe the programs that are impacted. Josh.
Thanks a lot, Jordan. So when I think about this Crisis Services Levy, and Jordan really nailed this, I think about it as responsibility. This is responsibility in action. Ultimately, the measure of us as a society, as people who love this place, is how responsible are we to one another, and how responsible are we to the care of this place? So if we jump back in time a little bit, as Jordan did, to the height of the pandemic, the POV had to go to half capacity. We saw the population of people living under the Reserve Street Bridge swell to numbers we had never imagined. This is really terrible for those folks who are living by the river. It's really terrible, was really terrible for the river itself. It was really terrible for people who were just driving by, seeing it all. This negatively affected everybody. We were able at the county, and with partners with the city too, we were able to partner up with Hope Rescue Mission and United Way to spin up the temporary safe outdoor space. And before we did this, we were able to send Eric Legvold from United Way off to visit similar places across the country where local governments had created safe places for people to be who had been living outdoors. Eric brought back some pretty simple but straightforward and powerful lessons. Scale matters a lot. Can't be too big. Services. There have to be services right on site. And security. And I want to dwell on this one a little bit. When people are living outdoors, their number one responsibility is to make sure their person and their stuff are not violated. That doesn't leave a lot of mental space to move your lives forward. But if there's security and you can leave your tent, you can let go of some of that anxiety and go do things like get your teeth fixed or get an ID or get involved in any of the number of services we have out there in the world. But at the beginning, I said responsibility to one another. That's to everybody. And the people who are living near the TSOS, we are equally responsible to them. And they were rightfully fearful of having this new thing in their neighborhood. Security means everybody feels more secure. So it's worth asking right now, well, did it work? Nearly 50% of the people that were at the TSOS are now in real housing. And it's not because we got them vouchers and into the tightest rental market in America. It's because, as Jim Hicks would say if he was here, it's about repairing relationships. People end up living outside, not because some terrible bad thing happened to them. Terrible bad things happen to all of us if we live long enough. It's just that there was no one there to catch them when they fell. And then they fell so hard that they were not able to be dealt with even by their family. But when those relationships were repaired, they could be back on their mother's couch, or their buddy's couch, or a friend's couch. Nearly 50%. This is huge success. I just have to tout it. But I don't want the mistake to be made that this crisis services levy is just about people who are living out of doors. I wanted to tout one real huge success. There are more big successes. As Jordan said, there's lots of ways to be in crisis. Just the other day, we got to chat with Kiki over there, who I don't know if you're chatting here today, but if you have the chance, talk to Kiki. In our podcast, Kiki said a crisis is when someone is facing problems that are so big, so intense that they feel insurmountable, and they simultaneously feel that they do not have the support to get past them, so they are stuck. Mental illness hits nearly every family. For all of us, it's pretty much a matter of when, not if, it touches our family. So imagine, and I'm using daughters as an example because I have two and I can talk with them and try not to cry. Imagining your daughter and her world implodes and she feels in crisis. The problems are too big for her and she doesn't feel like she has the support. Even if she actually does, she doesn't feel like she has the support she needs to get through it. She implodes. Do you want her going to jail? Do you want her to spend the most expensive 2 hours of her life at the emergency department so she can be let go with no real change? No. It would be way better to have somebody like Petroff and Kiki roll up the mobile support team, a paramedic and a social worker, get this person what they need and solve the problem, at least arrest the problem, slow it down in place at low to no cost, and then do follow-up and take the time that's required to help get people where they actually need to be. We're doing that with the mobile support team. You're going to hear about it in a minute. These types of things need to continue and will continue if we all choose to pass the crisis services levy. That's just the tip of the iceberg, and I could go on, but I won't, I promise. I'll bring on Mr. Petroff to talk some more. Thank you.
Thank you. Yeah, thank you. Thank you, Mayor and Commissioner. I'm John Petroff with the Mobile Support Team. I work out of the fire department. The Mobile Support Team is a collaboration between Partnership Health Center and the city of Missoula. So we are together in this. It really has been successful in a lot of ways. We are a team consisting of, as far as response, a team that is a clinician and an EMT that respond through the 911 system. So we respond in a van, which is behind us here. This is our mobile support team van. We respond to calls through 911 that are mental health related, that are not emergency medical service, they're not criminal, and they are not a fire. So we are the fourth response resource to this community right now. Right now, we have responded just this year to 2,006 calls within the year time frame. Of those calls, we've kept people in the community, in their homes, not going to the emergency department, not going to jail, not becoming homeless over 60% of the time right now, which is a lot of good numbers, but it also means that we're reducing trauma to our people. So reducing trauma to our clients, reducing trauma to your families, like we said. Only 30% of the people that we go on, a lot of times we think of this as a houseless issue. We do work closely with our houseless population because they need our help as well, but that is 30% of the time. The other time is with housed individuals in our community, which is, it's really important to note that because we are connecting them to resources as well beyond that initial call. So from there, we are connecting within our CIT partners, which you'll hear from CIT within Missoula today, and Teresa. We work with those partners who is everybody throughout that community. So it's hospitals, it's Partnership Health Center, it's the Poverello, it's literally everybody in our community. It's Hope Rescue. So many people that are here today. We're working with them to figure out what is best for that client at that time of crisis. And so we're able to take a different approach as a responder of not having to have a solution for them, but really meeting people where they're at in our community, both physically and emotionally. Again, a lot of people think that these services are only provided to the city. This is a city and a county resource. So we go outside of city limits as well. We go all the way. I was just in Sealy Lake this last Monday doing some outreach to them. Like, we will reach out to those communities as well. And that's really important because a lot of times in those rural communities, they don't have a lot of the resources that we have here in Missoula. So we're trying to connect it across the county. And that's why it's so important that we're doing this together. Without this funding, it's going to be difficult to expand hours and to do the things that the community deserves to really build this program and then build all these other programs that, honestly, without these other programs, the emergency departments and the jails are the places that we're going to have to continue to go. We need the crisis receiving center. We need all of these places for us to be successful, both as a community and as a response resource. So next, I'm going to pass it on to one of my mentors, Teresa Williams at CIT.
You're so sweet. Hi, everyone. I just feel very honored to be here with all of you, this community. My name's Teresa Williams, and I'm the Crisis Intervention Team Program Manager. I am housed at the police department, but our program serves Missoula County. I know a lot of folks here, so you may or may not know, but my experience as a social worker has involved working directly and indirectly with people experiencing houselessness, people involved in the criminal justice system, and people experiencing crisis or behavioral health concerns. My colleagues and my family members definitely know that I'm very passionate about crisis system reform, and they also know that as a social worker, my core values include accountability, collaboration, and wholeheartedness. That's why I keep holding my heart. This is, and I operate within these values both personally and professionally. I first became involved in the Crisis Intervention Team Program in 2015 when I was working in the jail diversion program at the Missoula County Detention Facility. 2 years ago, it became my full-time position, and I am incredibly lucky to be able to work in a program that is aligned both with my passion and my core values. Earlier, Commissioner Slotnick mentioned the definition of a crisis, and he said it with just beautiful passion. Anyone can experience a crisis. Most people have the resources and the support networks to return to their pre-crisis state. When someone has a diagnosed or untreated mental disorder, this can be even more challenging. Did you know that 1 in 5 adults in America will experience a mental health disorder? Did you know that the 3 of the most common disorders are anxiety, substance use, and depression? Did you also know that they commonly co-occur with substance use, so anxiety, mental depression, and substance use? When I teach in law enforcement and detention officers, I ask them, which disorder do you think is the most prominent and most prevalent in our community? I'm so interactive, I want to say, any guesses? Does anyone have any guesses? Let's just do that. Besides law enforcement, it's schizophrenia. They guess schizophrenia, when in reality, it's less than 1% of our population is diagnosed. I'll keep going. So I want you to take a moment and think about this, similarly to what Commissioner Slotnick and Mayor Hess had mentioned. How do you want yourself or a family member to be cared for in a crisis? How do you want yourself or a family member treated in a crisis? When I ask community members these questions, compassion, safety, empathy, and kindness come up frequently. This is also the question that I ask myself to stay grounded and committed to the work. and what I ask our law enforcement, our first responders, and others to think about when they are responding to someone in a crisis. What if this was your loved one? How would you want them to be treated? So today, I am going to talk a little bit about the CIT program, which is designed to reduce the reliance on the criminal justice system and instead divert individuals in crisis to behavioral health services. And I'll provide a little bit of some highlights of the program and what we've accomplished. And then I'm going to turn it over to my colleague and CIT officer, Lieutenant Ben Slater. So in Missoula County, individuals with serious mental health disorders are often unable to access services that could support their recovery. In turn, they are experiencing houselessness and often cycling through our jail and our ERs. And while we've made strides to address this crisis, there are still significant gaps in our crisis continuum. We are seeing shortages of mental health providers and substance use treatment services, and we have a crisis of affordable housing for people with disabilities that contributes to houselessness and instability. We are also missing a critical link in the crisis care continuum that would offer an alternative to the jail and the ER, a no wrong door, 23-hour and 59-minute crisis receiving facility. This type of facility would ideally provide an emergency entry into the behavioral health system and improve access to services. Now I have to address the misperception about CIT. Most people think it's crisis intervention training, but I'm here to inform you it is crisis intervention team. And as Lieutenant Slater pointed out, when we were talking about this, it's capital TEAM, underlined, italicized. We follow a national best practice model that started in the late 80s out of Memphis, Tennessee. And there are 10 core elements, and training is only one. Our local program goes beyond law enforcement training to improve policy, system coordination, and behavioral health services. So one of the highlights that I want to help you guys understand too, in terms of the team aspect and working with our mobile support partners, we host a bi-monthly stakeholder coordination team meeting. Over 100 cases have been discussed in our meetings so far this year. We meet twice a month, everyone, twice a month. Law enforcement refers the highest number of cases to be reviewed in these meetings, followed by behavioral health and then homeless and housing providers. We also work closely in terms of trying to build the workforce for the mobile support team. Our program supervises social work practicum students in the Wellness and Resource Access Program, and they're not here today, right? But mobile support team members Doug Cook and Mark Wayne were in our practicum and now work as clinicians on the mobile support team. Another cool thing that we've done this past year is that we're co-located with some amazing county diversion programs as well as our downtown police officer. So we are all working really closely. I have a lot of other highlights, but I'm going to skip them because of time. You can find them out in the open house. So we do this important work as a multi-agency team, as I've emphasized, by investing in relationships and partnerships and bringing together people living with mental illness, their families, mental health agencies, law enforcement, mobile support team members, service providers, and other stakeholders. If you're confused about the mobile support team and crisis intervention team, it's okay, it comes up a lot. You just need to know that the mobile support team is part of the crisis intervention team. It is a huge component of streamlining our crisis response system, and they join CIT-trained law enforcement, firefighters, service providers, and others that have graduated from our annual CIT Academy. These CIT-trained professionals are acting as one mind when they are on the streets responding to crises. And so it's important that we support our teams by zooming out and working with our community and our stakeholders to achieve our program goals at all levels: street response, acute care, stabilization, prevention. So in summary, we are all impacted, as we've heard today, in one way or another by mental health challenges, whether personally, professionally, on or off duty. And as a community program, we want to send a message of hope that we can help each other and we can work together towards solutions. It'll take creativity, investment, connectedness, innovation, commitment, trust, accountability. Are you hearing my values in there? The solution is not to train every officer or responder. The solution is system-wide changes in our housing and mental health care to ensure that jail is not the only destination during a behavioral health crisis. And regardless of whether or not you or your loved ones are impacted by mental health challenges or crises, I implore you to think, the next time you see someone struggling or you hear sirens in your neighborhood, what if this was my family member, and how would I want them to be cared for? So now I'm going to turn it over to Lieutenant Ben Slater.
I'm going to give you a minute to adjust to my glare. So again, my name is Lieutenant Ben Slater. I am a CIT law enforcement coordinator for Missoula as a whole, including the city and the county. I am employed as a lieutenant with the Missoula Police Department. Teresa and I have been partners, and part of what makes the crisis intervention team is a cooperative effort between law enforcement and mental health. It does require multiple partners to be able to have a successful program move forward. I've been an officer within our community since 2007, and I'm proud to say that crisis intervention team was one of the first trainings I attended in 2008. My experience as an officer has grown with the community as a whole. When we began, we had less access to services than we do today, and especially with the bringing crisis intervention team under the Missoula Police Department and back into the home of law enforcement, we have increased our ability to take an individual in a mental health crisis and direct them to a more appropriate service to be able to identify what their needs are. I often use the analogy that law enforcement is like a multi-tool. We are there to be able to solve many problems, but even though I can disassemble a car with the little Phillips head on my Leatherman, it's not the best tool for the job. And the best thing I can do with an individual who is exhibiting a mental health crisis is be able to recognize that it is a mental health crisis, respond appropriately with compassion and de-escalate the situation. But without the ability to resource them to some other professional, my efforts will be repeated day in and day out. Within our community, we've had officers within the emergency responder system respond to a number of crises. In a recent call, Montana Highway Patrol responded to a simple traffic stop that they've performed day in and day out. Within, they found a mother and their daughter, where the daughter was indeed in crisis. Fortunately, based on their training, those troopers recognized that this was beyond their span of influence, but they operated within Missoula County. They called the mobile support team over to be able to provide assistance. When that assistance did not meet the ends necessary, they reached out to the Missoula Police Department, who were able to send officers. At that time, we were able to assist the family and be able to relocate that youth to a crisis service facility so that they could stabilize that individual and return them back to their parent. Every day, our Missoula Police Department responds to those individuals in need. Now, with the benefits of programs similar to Crisis Intervention Team, as well as programs similar to RAP, we can take those individuals who are exhibiting homelessness, be able to identify their need or identify them as super utilizers, and, as you heard Teresa say, refer them to a working group to be able to identify a best resource and figure out where they are falling through the cracks and pull them back into system services. In your community, you have some of the best trained emergency responders that the state has to offer. Programs that are available and have been expanded through the ARPA funding help ensure that we are best suited to be able to respond to the needs of our community. Thank you.
Next, we have Jill Bonney from the Pavarilla Center.
Hi, I'm Jill Bonney, the Executive Director of the Pavarilla Center. We at the Pavarilla Center, along with probably most of you, deserve that every person deserves a safe and quality, affordable place to live. Unfortunately, the housing crisis in Missoula makes this harder than ever before. We know that houselessness is a national crisis, not just a Missoula crisis. Supporting our neighbors in crisis makes our community stronger as a whole. I know you keep hearing that word crisis, and yes, people who don't have a house to sleep in at night or know what they're going to eat for their next meal are definitely in crisis. For the past 2 winters, the Pavarilla Center has run the Emergency Winter Shelter, which provides essential shelter to an additional 135 of our neighbors living without a home. And For the past 2 winters, as far as we know, no individual has died on the streets of Missoula due to the inclement winter weather. In addition to a warm bed, the emergency winter shelter provides at least 1 hot meal a day. Bathrooms, showers, and laundry is also available. The accessibility created by the emergency winter shelter allows Poverello staff the ability to help people who may not otherwise access our daytime services. Emergency Winter Shelter is staffed around the clock by staff who have taken part in valuable staff trainings that include de-escalation, cultural awareness, suicide prevention, and others. Since the beginning of the COVID-19 pandemic, the Poverello Center Broadway shelter has operated at a limited capacity, and we have not seen any signs of the CDC lifting that guidance. This is one of the reasons why the Emergency Winter Shelter is so important. The Poverello Center shelter is already at capacity, and we're turning away around 30 individuals every night. With the availability of the winter shelter, we will be able to provide shelter to those 30 individuals and more. We served 772 unique individuals last winter. So 772 of our neighbors needed shelter at some point last winter, and we were able to provide it because of the emergency winter shelter. I'd like to tell you about one of our guests from last year. We'll call him Sam. Sam was really struggling last winter. He was struggling to stay sober, struggling with his family that didn't want anything to do with him. It was a tough winter for him, especially through the holidays. But we kept him warm, and we kept him safe, and we made sure he knew he wasn't alone. Now Sam is back on his feet. He went to treatment. He has a stable job. He's in housing and is back with his children. He's been sober for 4 months. He didn't have to worry every night if he was going to freeze to death or if he would have food to eat. With his basic needs met, he was able to concentrate on taking care of himself in other ways. He had a little more hope and a little less crisis in his life. Without the emergency winter shelter, many of our neighbors would be on the street in the cold during the cold Montana winter months.
Thanks, Jill. Well, I want to thank everyone. I want to thank you all for coming today, and thank our partners and providers for sharing a little bit about what they do. All of the work that they do embodies values that we have as a community, values of compassion and kindness, values of accountability and responsibility. And these values are on the ballot this fall, and so I thank you for coming out to learn more about the programs that would be supported by the Crisis Services or Crisis Intervention Levy.